Sexual performance is not only about desire. It depends on blood flow, nerve function, hormone balance, energy, mood, and the overall condition of the body. That is why habits that damage the vascular system, metabolism, or nervous system often show up in the bedroom sooner than men expect. Erectile dysfunction, for example, can be linked to smoking, heavy alcohol use, diabetes, obesity, and other conditions that affect blood vessels and nerves. A lot of men ask whether sugar, alcohol, or cigarettes really affect sexual performance, or whether that is just another health warning people repeat without evidence. The medically honest answer is yes, they can affect it, and in different ways. Not every man will feel the effect at the same speed or to the same degree, but all three can push the body in a direction that makes erections, libido, stamina, and overall sexual function less reliable over time. Let's start with sugar. Sugar is not harmful because one dessert instantly causes erectile dysfunction. The bigger issue is the pattern. When sugar intake is high enough to promote weight gain, insulin resistance, prediabetes, or diabetes, sexual performance can suffer because blood vessels and nerves are put under stress. Nick explains that high blood glucose can damage blood vessels and nerves, and that this damage can lead to sexual problems. Mayo Clinic also notes that in diabetes, long-term high blood sugar can damage the nerves and blood vessels needed for an erection. This matters because an erection is not just a mental event. It is a vascular event. Blood has to move into the penis efficiently and stay there. If blood vessels are not healthy, or if the nerves involved in sexual response are damaged, erection quality can drop. That is one reason erectile dysfunction is common in men with diabetes, especially type 2 diabetes. Mayo Clinic states this directly, and NIDDK links diabetes-related sexual problems to damage in blood vessels and nerves. So when people say sugar can affect your sexual performance, the more precise way to say it is this: chronically poor blood sugar control can damage the systems that erections depend on. Sugar-heavy eating patterns can also contribute to abdominal weight gain and obesity itself is a known risk factor for erectile dysfunction. Nick and Mayo Clinic both list obesity and diabetes among factors that raise ED risk. Now let's move to alcohol. Alcohol can affect sexual performance in both the short term and the long term. In the short term, alcohol can reduce inhibition, but that does not mean it improves sexual function. Cleveland Clinic notes that drinking alcohol can affect erections, and Mayo Clinic states that alcohol impairs erections. In other words, a man may feel mentally looser after drinking, but physically less reliable. In the long term, drinking too much alcohol can worsen several of the systems involved in sexual health. Mayo Clinic notes that heavy alcohol use can contribute to heart disease, high blood pressure, and high cholesterol, all of which matter for vascular health and erectile function. Cleveland Clinic also notes that excessive alcohol can lower testosterone, decrease libido, and place added stress on the body. This is why alcohol can create a misleading pattern. Some men think alcohol helps them sexually because it reduces anxiety in the moment. But if the dose is high enough, erection quality may drop, sensitivity may become less coordinated, ejaculation control may become less predictable, and overall responsiveness may worsen. Then, if drinking becomes frequent, the long-term effects on sleep, hormones, body composition, and cardiovascular health start making the situation even worse. Cleveland Clinic specifically notes that too much alcohol can impact sex drive, and Mayo Clinic states that alcohol also impairs erections. Now let's talk about cigarettes. Smoking is one of the clearest lifestyle risks for erectile dysfunction. Mayo Clinic lists smoking as a cause of ED, and NIDDK lists smoking cigarettes among lifestyle behaviors that make ED more likely. This is not surprising because smoking damages blood vessels, promotes cardiovascular disease, and narrows circulation. Nick also explains that smoking causes blood vessels to narrow. And this is especially important in sexual health because the blood vessels involved in erections are small. When circulation is compromised, the penis may show it earlier than other body systems. Harvard Health notes that many men with impotence from vascular disease also have a history of heart disease, stroke, or poor circulation in their legs. Mayo Clinic also describes erectile dysfunction as sometimes being a sign of heart disease and specifically identifies tobacco use as a cause of ED. Smoking may also affect sexual performance indirectly through hormones and libido. Cleveland Clinic notes that smoking can suppress testosterone levels, which can lower sex drive. That does not mean smoking is the only cause of low libido, but it does mean cigarettes can hit sexual performance from more than one angle: blood flow, cardiovascular strain, and hormonal impact. So if we put all three together, the pattern becomes very clear. Too much sugar can drive blood sugar problems, weight gain, diabetes, and vascular and nerve damage. Too much alcohol can impair erections in the short term and damage hormonal, cardiovascular, and metabolic health over time. Cigarettes can narrow blood vessels, worsen circulation, increase cardiovascular risk, and may also suppress testosterone. All three can make sexual performance less reliable, not always overnight, but gradually and often silently. This is also why erectile dysfunction should not always be treated as an isolated bedroom problem. The American and NIH-based sources used here consistently frame ED as something that may reflect bigger health issues involving blood vessels, nerves, metabolism, and lifestyle. Nick states that diseases or conditions affecting blood vessels, nerves, or hormones can lead to ED, and that lifestyle behaviors can contribute as well. That means the man who says, "My sexual performance is getting worse," may also be saying, without realizing it, "My vascular health is getting worse," or "My blood sugar is not under control," or "My body is under too much lifestyle stress." In some men, sexual performance becomes an early warning sign. Mayo Clinic and Harvard both emphasize that ED can be connected to cardiovascular disease and vascular health. Now, this does not mean every erection problem is caused by sugar, alcohol, or cigarettes. Anxiety, medication side effects, relationship stress, depression, fatigue, low libido, and other conditions can also play a role. Nick and Cleveland Clinic both note that ED can have multiple causes, including emotional issues, medicines, and substances. But if a man is eating poorly, drinking heavily, smoking regularly, sleeping badly, gaining abdominal fat, and moving very little, then he is building the exact environment in which sexual performance tends to decline. At that point, the body is not failing randomly. It is responding to the pressure being placed on it. So, what is the practical message? First, stop thinking of sexual performance as something separate from the rest of your health. Erections depend on circulation. Libido depends partly on hormones, energy, and mental state. Sexual confidence depends on how the body is functioning as a whole. Second, understand that cutting back on sugar is not only about weight. It is also about protecting blood sugar control, blood vessels, and nerves. Better blood glucose control can help protect the systems involved in erectile function. Nick and Mayo Clinic both say this clearly in the context of diabetes. Third, understand that alcohol is not a reliable sexual aid. It may reduce anxiety temporarily, but it can impair erections in the moment and worsen sexual health over time if overused. Fourth, understand that smoking is not just a lung issue. It is a circulation issue, and circulation is central to sexual performance. And finally, if sexual performance is getting worse consistently, do not just hide it or self-diagnose from social media. Mayo Clinic notes that diagnosing ED starts with medical and sexual history and may require evaluation for underlying conditions. Persistent problems deserve real attention. So let's bring it all together. Sugar, alcohol, and cigarettes can all hurt your sexual performance, but not always in the same way. Sugar-related metabolic problems can damage blood vessels and nerves. Alcohol can impair erections in the short term and contribute to hormonal and cardiovascular problems over time. Cigarettes can narrow blood vessels, damage circulation, and may also lower libido through hormonal effects. When these habits are repeated long enough, the bedroom often becomes one of the first places the body reveals the cost.